Hi, my name is Ayla Mueen, and I'm a family physician in Saskatoon. My project was to improve HIV preventive care at Student Wellness Center, University of Saskatchewan. Prior to 2019, we were not providing the service at all at our clinic, and our aim was that by May 2020, we would increase the number of students being assessed for preventive treatment to 30. We identified 4 possible intervention areas to achieve this. We needed a prescription process, we needed to make sure there was enough student demand for it, and we needed to increase referrals from both within the clinic and outside it. We started off by increasing the comfort level of family physicians in order to become prescribers. We have 7 physicians working at our clinic, and out of those, 3 are willing to prescribe. Next, we turned to referrals from nurses. At the end of the study period, 35% of the patients who had presented to our clinic for STI screening had been offered assessment by the nurses. And out of those, 75% ended up being assessed. We then turned to the students to get a better understanding of what their needs were. We held a focus group in March 2020, and we all know what happened. A week later, the university was closed, unfortunately, because of the pandemic. So if you remember the magic number from my second slide, which was our aim statement, so far we have seen 15 students for preventive treatment. So we reached 50% of our target. This is what our journey has been like to reach those 15. It's slowish, but steady. So my key learnings from this project were based on some of the challenges that I faced. First and foremost, I realized how important it is to have data. We started this project without any, and it was kind of like flying blind. We didn't know if we were aiming too high, too low, or just about right. Next, it's really important to engage everyone possible to get different perspectives on the table. And most of all, in preventive care, it's very important to engage students. And finally, as we've heard before, preventive care must go on in face of pandemic or other crisis. So where are we going from here? We're taking a little bit of a detour and doing a research project that came from this QI project. We're doing a student survey to find out more about the attitudes of students about preventive treatment and identifying barriers to access. We'll head back to our PDSAs involving increasing referrals from our counselors within the clinic as well as from family physicians within the community. I would like to thank all the CQIP faculty, my coach, my sponsor, my PFA, and my data analyst from SHA, and last but not the least, all my fellow participants for their feedback and encouragement that made this project possible. Thank you.